Welcome everyone to another wonderful episode here, Jaws Podiatry. Exactly. Que no se me caiga. A case follow-up, case update, young gentleman, only 89 years old. This is the patient that
3 more months, I'll be 90.
Booyah!
April the 8th, I'll be 90.
How much? This is the patient that we presented last week. We performed a partial ray resection, amputation of we debrided the bone. This is the patient that we amputated the actual toe here in the office. We debrided the bone in the operating room. Last week, come around here, just a refresh, come around this way. We did remove all of the sutures here. Everything is still, the incision is well coapted, looks beautiful. Now here, as everyone recalls, remembers, right? He's just gonna kinda, it's okay. It's okay, it's like Disney World here. 1 second, it's okay. Okay, let's go back up. Here we go. That's good for now, super. So, now people can get a really good visual. There's still a little bit of a little crater here. We're gonna work on that. Continue aggressive local wound care. I have some ideas in respect to what we can do here. Let's go to the, so on the on the lateral aspect of the foot. Again, just to refresh everyone's memory, he had a big scab. The scab eventually fell off, and last week I was extremely concerned because at this point in time, even though he did see our good friend, the endovascular surgeon, we maximized his perfusion down to the foot. Regardless of that, my concern is bone infection of the fifth metatarsal. Bone infection, when there is when the bone is infected, aggressive workup is critical. Whether it's admission to the hospital, in his particular case, we're not able to perform an MRI even without the contrast because he does have there are some contraindications to him having an MRI. So the next step would be to maybe take a little piece of the bone of the fifth metatarsal to see if there's any actual bone infection. That's my concern. Sure, we can get x-rays, and sometimes with x-rays we're able to visualize some radiographic changes in the bone that may suggest the possibility of bone infection. Let's take a look. So again, table up, here we go. There you go. Thank you. Okay, so what are we looking at today? It's really hard to say. We look at measurements, and it appears to be a little bit smaller. He does have, again, this gooky fibrin film. This is devitalized avascular. We're almost done here, bud. See? And Dr. Wagner, well, if the previous surgery healed with no problems, why wouldn't this defect heal as well? And again, I'm debriding, and where is the blood? I apologize, my friend. No, where's the blood? Where's the blood? I'm looking for blood. I'm trying to find that happy place. Where is the blood? Where is the blood? See this? Take this little piece and we're done here. And there's another technique that I'm going to try with him. It's called a cross-hatching technique, right? I'm actually, in lay terms, I guess, chicken scratching the base. And there's still no blood. Very little. See? No blood. Okay. So then we'll... So sorry, my friend. Are we still friends? Are we still friends?
Yeah?
Okay. So what I'd like to do is the probe to bone, this exam. So I definitely can feel the bone, but it's not exposed. Okay. There's the bone. The bone has a blanket, several. And if the blanket is intact, there's still a possibility, right, that we can prevent any bone infection. But my only concern is the lack of blood supply to the area. So I think that we have two options here. You know, the lower extremity is very intricate in respect to the circulatory arterial system. One option is to send him back to my dear friend, okay, to see if he can somehow get more blood supply to that side of the foot, right? We don't only have one main artery to the foot, we have several. So can he actually revisit the entire extremity and say, hey, Wagner, I think we can do this, right? I think we can possibly get more blood to the area, just like they did on the other side. That's why it healed beautifully.
I know.
I know you know. Or, because we can throw everything, just so everyone understands, right now we're just applying, let me show the public here, 1 second. This is, it's a medication that is, in the good old days, I don't know what the price of gold is today, but in the good old days, this was ounce to ounce more expensive than gold. Let me cover his name. Well, basically, it's called Granules, okay? Granules. And these are basically living cells to a certain extent. Okay? And this has been around for a very long time. Okay? Regranics. And it doesn't matter if we use Regranics, which is top notch. It doesn't matter if we use mayonnaise, ketchup. It doesn't matter what we throw on it, what we apply on it. If there's no blood, there's no healing. You can throw gold dust on this and it won't heal without the blood. What does my gut tell me? That we need to, before we do anything, we need to send him back to the plumber, my good friend. I'm just mentioning no names.
I can't hear what he's saying.
It doesn't matter.
What? No, I'm just kidding.
It doesn't matter.
I'm gonna speak to him today, and let's send him over there, and then after that, you know, we'll talk about other solutions right after I sign off as we speak now. Like always, I will keep everyone afloat on this patient's progress. www.josspodiatry.com, Instagram, Dr. Tojan, Joss Podiatry, Facebook, and last but not least, our YouTube channel, Joss Healthcare. For anyone that's wondering out there, the worst case scenario, is that he does have bone infection. And once, if there is bone infection, the only way to eradicate the bone infection, just like we did before, is to remove the bone, that portion of the bone. And we would follow the same protocol as we just followed, you know, with the great toe and the first metatarsal. Have a nice day, everyone.